Today, we're going to talk about why it's important as a woman over 40 to take vitamin K2 with your D3. I see a lot of women making this mistake, and I just want you to thrive. I am Robin-Nutritionist, and I help women over 40 use food, targeted nutrition, and simple strategies so that we feel good inside and out and mitigate these hormonal shifts that are happening. So let's talk about vitamin D, why it's important, what it does for you, and what happens when you're not taking K2 with your vitamin D. First of all, what vitamin D does. I'm going to go through a list. A lot of women are deficient, and this is the number one supplement for women in the perimenopause and menopause phase. So, vitamin D, people think only for the bones. No, vitamin D helps your mood, your blood sugar, helps to reduce autoimmune issues. It helps you regulate blood pressure, bone health, muscle strength. It's anti-inflammatory. It helps shrink fibroids. It helps the vaginal area stay well, stay lubricated, keep our cells good down there. It reduces the risk for breast cancer, colon cancer, ovarian cancer, our immune system. I mean, it does a lot of stuff for us. So if you're not taking D3 with K2, you may be doing yourself a disservice. Yes, vitamin D comes from the sun. We're not in the sun. And the older we get, the less effective that is. And then if you're a Black woman, you have melanated skin, that is a protective barrier. The older we get, the more that supplementation just literally makes sense. Signs that you are deficient in vitamin D, you're tired all the time, your mood is different, you may get sick, you have bone pain, muscle weakness, your hair is thinning and falling out. You watch your vitamin D levels at a therapeutic range between 60 and 80. When you're in that range, your body is maximally supported. If your vitamin D is below 30, you're deficient, super deficient. If it's between 30 and the 40s, it's like minimum wage. You could survive, you're not deficient, but are you maximally supported? No. So you want to get it in between the 60 and 80 range so that your body is maximally supported. All right, so what's up with this K2 and why is it important? So K2 helps to ensure that the calcium that is in our body doesn't deposit in our arteries, in our kidneys, and places that it doesn't belong and create long-term cardiovascular issues. At this big age, we are more susceptible to cardiac issues. So we want to pull out all the stops and do all the things that we can do to prevent them. So that K2, coupled with the vitamin D, helps to get the calcium that's in your body to the bones where it belongs and away from your arteries and away from your kidneys where it doesn't belong. You've heard of arterial calcification or vascular calcification. You don't want that. And that's what that K2 helps to do. Now, if you are on a blood thinner, Coumadin, warfarin, the baby aspirin doesn't count for that. But if you're on blood thinning medications, you want to consult with your doctor before taking the D3K2 because the K2 can interfere with the effectiveness of the blood thinning medication. So you want to talk to your doctor. Also, you want to connect with your doctor if you have kidney disease or you're on dialysis. But other than that, if neither of those are true for you, then take your D3 with K2. Obviously, I'm going to tell you to take Necessary Nutrition's D3K2. I will put the information in the down bar. I did introduce myself. I did. Food sources for the K2 include fermented soy, egg yolks, hard cheeses. You can get it from food, but just go ahead and marry the D3 and the K2 supplement and get yourself covered. Again, I see so many women out there without taking, good high levels of vitamin D without that K2. In this age, we need all the support for our heart, for our bones, for all of the systems in our body to work. And it's one supplement combined. So there. Down below, you can grab the information about Necessary Nutrition's D3K2. Also, if you need a nutrition reset, I offer a 7-day nutrition reset. It's a freebie. So for 7 days, I am going to coach you and support you to flooding your body with the foods that it needs and removing the foods and the habits that do not serve you for 7 days. So that I will put in the description below as well. Got questions? Leave a comment. I'll be sure to answer them. Eat well, think well, and be well. This is Robin, Necessary Nutrition.